Hello, my name is Albert Park. I'm a pediatric ear, nose, and throat physician at the University of Utah who's had the honor to treat and evaluate many children with cytomegalovirus and hearing loss. I've treated children for over 20 years. I am also a clinical researcher and head an international NIH-funded clinical trial for CMV children called ValEAR. Unfortunately, I assume that you are listening to me because your child or loved one has this condition. This is a difficult time for you, but I want to reassure you that we know so much more about this disease and are continuing to find better treatments. One example is the Utah mandate that passed in 2013. Parents, doctors, and researchers advocated and got a law passed that offers early CMV screening for any child who fails his or her newborn hearing test. This and other early CMV screening approaches have now been started throughout the country. The ValEAR study was created to answer a common and difficult set of questions. Is an antiviral drug called valganciclovir safe and effective in treating CMV-infected children with hearing loss? From our and other studies, unfortunately, I think that regardless of whether you elect to treat your child with this drug or not, there is a very high chance that your child will develop future worsening hearing. That means negative effects on your child's speech, learning, increased costs for speech and language services, a need for a stronger hearing aid, or even, unfortunately, a cochlear implant. These costs can run into the tens to hundreds of thousands of dollars, and I would like to find out whether this drug can help your child. Currently, the standard of treatment in the United States is not to use this drug, because there's a lack of good evidence for or against treatment. The only way that we will know if this medication can work is by having families like you participate in this trial. The structure of this study is what is known as a randomized trial. The group that your child will enter will be either to get the drug valganciclovir or not. This is the only approach that will definitively answer whether the drug is safe and effective. However, regardless of which group you are in, you will join our CMV family. If you join us, and that decision is entirely up to you, you will have access to our team. That includes my personal email address, our knowledge, and the latest information on this condition. I can say that we will follow your child very closely using the best laboratory, hearing, and speech testing that has been vetted by the NIH, the FDA, and our team. For instance, since we check every hearing test, we found a few children who did not get all the testing that they needed. We notified the hearing team from that hospital and made sure that the right testing was done. Since we check all safety laboratories very frequently, we detected an abnormally low blood count that likely would not have been found if your child was not in the study. We held the study drug and had the child see a specialist before the low blood count became a problem. We should know in a few years whether this drug helps or does not help your child. We will also have more information from other trials that may help your child when he or she is older. We will then be able to provide information that is not available to other parents in your condition. So, I hope that you consider joining us. Please feel free to call or contact me if you have further questions. Thank you so much for your consideration.